Hi everyone, my name is Ina Yermolov and I am a registered nurse, and as you can probably see by the title of this PowerPoint presentation, the topic that I'm going to be covering is chronic migraines. So basically, before I get started, this PowerPoint is going to cover a web quest I did, and I'm going to be talking about what a migraine is, as well as covering 3 sites that I thought would be helpful for a patient who has a chronic migraine problem. Okay, so let's get into the PowerPoint. So for the first slide, I want to first describe what a chronic migraine is. So what it is an illness that is diagnosed in patients suffering from at least 15 headache days per month, of which at least 8 of those days are related to migraines. So a migraine is a type of headache. It is caused by dilation and constriction of the blood vessels in the head, which causes symptoms such as nausea, vomiting, light and sound sensitivity, and in a lot of cases, intense throbbing pain on one or both sides of the head. And although the exact chain of events that causes a migraine aren't really known or clear, it is caused by abnormal brain activity that is triggered by a variety of things like stress, caffeine, chocolate, and so on. So, what is basically known about migraines is that they are attacks that begin in the brain and involve nerve pathways and chemicals that can affect blood flow in the brain and surrounding tissues. Also, just as a point, there are 2 main types of migraines: those with aura, or otherwise known as classic migraines, and those without aura, which is a common migraine. An aura is a group of nervous system symptoms and is considered a warning sign that a migraine is coming, or often occurs about 10 to 15 minutes prior to the start of a migraine, but also can happen up to 24 hours beforehand. An aura can be like a smell, vision change, or other things like that. All right, so now that we've discussed what a chronic migraine is, this slide is going to take us through the web quest that I did on this topic. So basically what this means is that I conducted an internet search using the Google search engine and searched the chronic illness of a migraine. And the reason for doing this was to learn about migraines and find means to support and locate ways to help to manage the feelings of people that struggle with this chronic illness. So, what I hoped to find with the web quest was a lot of information, specifically information on what the pathophysiology of the migraine is. The reason I kind of kept my focus on that as I was searching different sites is because I believe that once a person understands what is physically happening in their body, they can definitely better take care of the problem they are dealing with. So the search terms I used was just migraines, support groups for migraines, and managing feelings migraines. So the next 3 slides are going to cover what I found. Okay, so the first piece of material that I found was a good old YouTube video. I really liked this YouTube video in particular because in it, the doctor of the NeuroPlus Institute covers what is actually happening when someone gets a migraine headache, but also how directing care to the root cause can make all the difference in how someone with a chronic migraine feels. So this video is a great way to help patients manage their feelings because they are being educated on what a migraine is and all the factors that make up a migraine. It also gives some hope to an individual by letting them understand how they can manage their migraines and to be direct and isolated and specific with the management. So unfortunately, the YouTube video is not playing on here, so I'm just going to include a link on the bottom here. All right, so for this slide, I searched support groups and I found Johns Hopkins Medicine support groups. So what I thought would be helpful with this site was that it listed a bunch of support groups for individuals with chronic migraines from a lot of different states actually, but also had a bunch of headache related sites linked in it, articles, forums, support groups themselves, and just a lot of resources to choose from and learn about this chronic illness. So, kind of continuing it in the same path as the support groups, this next search was managing feelings that come from dealing with this chronic illness. So, what I found was another site. It is a .com site, but I liked that because it allowed so many different things to read about feelings and talk to others in discussion forums, but also share your story and read other stories. The other stories was what really caught my attention because it really puts the emphasis that you're not alone in this situation. Okay, so now that I've given like a quick overview of the sites from my web quest, I'm going to relate it to the readings from weeks 1 and 2 and focus it more on the book. If you have to wear an ugly dress, learn to accessorize. So some of the similarities that I found between the two were that in the book it talked about that when we go through any kind of life trauma, we need to feel a sense of mourning, loss, and fear, but not let that negative emotion be covered up because it's part of the natural process, and addressing those feelings can definitely decrease depression, anxiety, and other symptoms. So both the web quest and the book wants the patient to not cover up their emotions. Another similarity is that they both address that it was definitely normal to go through the stages of grief and to do so. Support groups are great for that. On the other hand, the differences that I found were that the book covered spirituality, but the web quest was very factual research information, not including any beliefs or praying or really addressing the need to address spirituality, which is definitely important because spirituality contributes to health and well-being. Also, another difference was that in the book it said that if you reach a point where you're desperate and feel like giving up and don't know what else to do, to call the National Suicide Hotline. And then I have the number listed here on the slide because just talking to someone who is skilled in listening might help you feel less alone and less anxious, which allows hope to return. So the web quest really didn't go too far into addressing kind of feeling alone. So in this slide, I kind of wanted to give a little personal touch and say what I've learned through my personal experience with the emotional side of having chronic migraines and how to manage them. So when I reached the point in my life where my migraines were affecting my ability to even function, let alone concentrate and see right, I definitely can relate to going through the stages of grief and figuring ways out to how do I continue living a quality life when I can barely function. So a big takeaway that I wanted to share is that treatments work and then they stop. The main thing to understand though is that it's so important to know your own body and the stress you put it under, because changing or even eliminating things that you might have never thought that caused you stress or stressed you out can help so much. So pay attention to how your body reacts to everything around you. So as a closing for this PowerPoint, I went over what a migraine is, some of the supports that are out there on the web, and just addressing how different resources are similar or different from each other. Hope you've enjoyed this video. And these are my references.